lambs we gather, hearts of fire all along. Oh, big Nick, cause we follow through the storm and through the fight. For Valhalla we will borrow strength and might under moonlight. Warriors of the ancient sea, songs of glory dark and bold. In the night, our spirits free, legends born, tales unfold. Oh, big because we follow through the storm and through the fight. For Valhalla we will borrow strength and might under moonlight. From horizons wild we roam, with thunder in our soul. Every battle brings us home to the stories ages told. Oh, big Nick, cause we follow through the storm and through the fight. For Valhalla we will borrow strength and might under moonlight.
Yo, folks. No need to stare into my bathroom. Hello, folks. Good to have you here. Good to have you here. Part 2 in the story of the Hernandez family, and whose babies were taken away by the government in the shape of what is supposed to be medical professionals. This went on between 2023 and 2025. Emma Hernandez, at 3 months old, was the pediatrician thought she saw something that was maybe abuse, reported it to CHOA, Children's Hospital of Atlanta. And in there, the Hernandez family didn't have a chance. It became a nightmare for the Hernandez family. An absolute nightmare. The trial happened last year. The Hernandez family won. So this is spoiler. So why am I streaming this trial? Why am Megan Fox streaming this trial? Because folks don't know what goes on in children's hospitals around the United States. That innocent people get their lives ruined because somebody thought they saw something. And in Emma's case, they ignored all the facts. So, what was it, Saturday or Sunday? We watched the opening statements. Now, we are going to run into the first witness for the state, which is the initial pediatrician. Oh, hey, Fiery Red, good to have you here. And Dave is here. Denise Sells, Gwendolyn, Calico, as David, and the rest of you. And hello, you guys over at Rumble. Streaming at YouTube and Rumble. Because you always need a backup. All right, folks. Are you ready for Dr. Ananda Chunduri? Well, here she is.
My name is Ananda Chunduri. Last name Chunduri.
And everybody here to witness that you're, thank you. You guys.
Thank you. Dr. Chunduri, just for the court reporter, can you also spell your first name?
Ananda Madhuri.
Thank you. And Dr. Chunduri, what is your profession?
I'm a pediatrician.
And do you have practice?
Yes, I have my own solo practice, Sunshine Pediatrics.
And how long has Sunshine Pediatrics been around?
From 2016.
And how long have you been a pediatrician?
I've been a pediatrician for about 20 years now.
And can you please go over your educational background and medical training?
I did my med school in India. I graduated in 2000, moved to US in 2000.
I did my medical school in India. In India, there are close to 50,000 medical schools. How about you name which one it was? But she doesn't.
2002, took my entrance exams, went to the University of Alabama, started my family practice residency, fell in love with pediatrics. So after 1 year, I reapplied for a pediatric residency program and moved to pediatrics. Graduated in 2008.
And are you board certified?
Yes, I am.
In what area?
In general pediatrics.
And are you licensed to practice medicine in the state of Georgia?
Yes.
And do you know Emma Hernandez?
Yes, she used to be my patient.
Okay. And what was the first date that you met Emma?
I'm going to confirm my names. The first date I met Emma was March 16th, 2023.
And what was the reason for that appointment?
That appointment was for a newborn wellness visit.
And when was she born?
She was born on the 13th of March.
And what happens at a newborn wellness appointment?
So this visit is mostly to help with transition for the baby, adjusting from being in the mother's womb to being in this world, to help parents adjust with transition of having a newborn baby at home, making sure that the baby's needs are met adequately, nutritional needs, ensuring baby's safety. Does she have a car seat? Is there a crib at home? Where is she sleeping? Are there guns in the household? Is anybody smoking? And so on.
Why does that matter? Are there any guns in the household? It shouldn't matter, because a gun in the household is a nothing burger unless there are drug issues or the parents are already in the family court system, or there are priors on either of them. If anybody asked me as I go to the doctor, well, do you have any guns in the house? And I would say, that's none of your fucking business.
Also to answer any questions that the parent may have.
And during the newborn wellness appointment, do you also perform a physical exam?
Yes.
And I guess, let me go back. When parents show up to a newborn wellness appointment, do they bring any paperwork with them?
Yes, they usually bring what we call newborn packet from the hospital where the child is born. It has information relevant to the baby, something during mom's pregnancy, the delivery process, and the initial 2 days of life.
Now, do you usually go over that packet during the newborn wellness appointment?
Yes,
And do you also go over any immediate medical care that may be needed for the child?
yes. We go over the packet, all the details, examine the baby, discuss the situation with the parents, and answer all questions, and kind of come up with a plan of wellness care for the infant for the future.
And how do you know if the child needs immediate medical care?
So there are a list of things that if the baby has any medical needs, as in not breathing properly or has a fever, then they need to seek medical care. If the baby is not getting adequate nutrition, losing weight rapidly, or not gaining adequate weight, that's when they need to seek medical care. If a baby is fussy and the parents are not able to console, since the child is non-verbal at that age, a fussy infant is also a reason to seek medical care.
Was Emma in need of any immediate medical care for this newborn wellness appointment?
No, not at that appointment.
And were there any birth complications?
No,
Was this a C-section, vaginal birth?
this is a vaginal delivery.
Okay. And when you did the physical examination of Emma, what, if anything, did you notice?
The newborn exam was completely within normal limits. Everything seemed
Remember that, within the normal limits. Remember that phrase. It becomes important later.
appropriate.
And when you say everything, what are you checking for?
So we are checking for the general status of the baby. If the baby is alert and responsive to stimulation, we're checking for reflexes. We're checking for muscular tone. If they have a good suck, good color, examining the head, the soft spots of the head, the fontanelle, the ENT exam, heart, lung, abdomen, hips, musculoskeletal exam.
Were there any signs of birth injuries?
No,
And I guess have you seen children with birth injuries in your practice?
yes.
And usually what kind of injuries do you see?
So the most common birth injury we see would be a swelling on the scalp because of vaginal delivery, something we call
Fiery Red, you're going to be so mad
that
in
we
a
see on
while.
the head sometimes, and sometimes there's bleeding into the scalp again during vaginal delivery only, not seen in C-sections, and that's a cephalhematoma. Sometimes you see nerve injuries if the baby's big and the shoulder is stuck in the birth canal.
And was Emma a big child?
No,
And he's talked about scalp swelling on the scalp because of vaginal delivery. Does that swelling usually go down
it usually goes down on its own in the first few days of life.
within the first few days? Okay. Was there anything at all unusual about her eyes?
Nothing unusual. She had very mild jaundice, which is very common, and it was within acceptable limits at that age.
Was there anything wrong with her sclera?
The sclera is where you see the jaundice, and it was very mild.
Okay. Was there anything wrong with her skin?
No,
Was there anything wrong with her abdomen?
no,
And was she able to move all her four extremities well?
yes,
Did you see anything of concern of Emma on that newborn wellness check?
no,
Now, on March 30, 2023, did you see the child again?
yes.
And what was that for?
The purpose of that visit is for rechecking her weight. Most babies lose weight in the first few days after they're born. This visit is to ensure that the baby is gaining weight again and gaining weight adequately. It's also to go over newborn screening results.
Okay. And was Emma gaining weight appropriately?
Yes,
And do you know how she was being fed?
she was exclusively breastfed.
And you said that you also go over newborn screening. Was there anything about her newborn screening?
Yes, her newborn screening results were abnormal in one area where they tested for cystic fibrosis.
Your Honor, I would just, if she's gonna talk about something, I'm gonna object, but if we're gonna talk about something as far as a document or a record and refer to that, I would like to have that put into the record at this time.
Yeah, one thing that you will get accustomed to as we go through this trial is that the prosecution do not announce to the court, we would like to admit States Exhibit 1, whatever. You will also grow accustomed to the prosecutor not asking the judge, may I approach the witness? You will get accustomed to a lot of things that, in all honesty, is a bit disrespectful from the prosecution.
She's testifying about records and for the child.
She's testifying about screening results.
Right,
We have,
She's,
those screening results.
how do you know, I guess, let me go back. How do you know what the testing results are?
So the State Metabolic Screening Department sends us the screening results, and they are a part of her medical record. Yeah.
Your Honor, at this time, the state would tender State's Exhibit 2, the Shella records.
No, Judge.
okay, without objection, that you may proceed.
Thank you. And Dr. Chunduri, so you said that she tested abnormal for cystic fibrosis, or I'm sorry, she screened positive for cystic fibrosis. What happens after that?
So if a screening test is positive, then they need a confirmatory test. So she was.
I apologize, if I could object, if we have the State's Exhibit 2 as the copy of the CHOA records that are apparently current to February 2024, I would ask that we go ahead and place that into evidence with the appropriate stickers so that we can all refer to it with the witness, and I would ask that they refer to page numbers if they are referring to specific test results.
Yeah. As I said, the prosecution really don't want to appropriately admit and reference the documents they are presenting. Let me give you an example. Now, this SHOA report or the entire medical chart of Emma Hernandez. There are hundreds of pages in there. So when they reference in a trial, they should go, yes, States Exhibit 2 is the SHOA report, the SHOA medical journal, whatever's. This is page 5. Let's say it's page 5. That is the States Exhibit 2A. That way, the court reporter can check easily. The trial transcript will be easier to follow, and both parties will know, okay, what are you referencing to? Well, I'm referencing to 2A. This prosecutor, no. Why don't just the entire journal under the 2? It's so disrespectful.
Exhibit 2 is at the
That's a CHOA record.
certified route. So
Yes.
they're in.
Yeah, already in.
Well, and if we could physically put them in so that they are accessible to both sides to use as a reference point with the witness on the records.
Very good. Oh, very well, thank you.
Dr. Chunduri, so what do you do after a abnormal screen?
Like I was saying, she was scheduled to get a confirmatory test with Children's Healthcare, which she did, and that was normal. So the screening result was a false positive.
Okay. And can you kind of tell us what's the difference between screen versus the test?
The screening test is a much more broader test intended to catch all the children who have it, but sometimes unintentionally there are a few false positives, and you're also catching children who do not have it. And then when you do the confirmatory test, which is very specific for that disease, that tells you whether the child has the disease or not.
So does
Now, why do some of these tests do a false positive? Well, there might be underlying deficiencies that the test also reacts to. Normally, okay, it's not cystic fibrosis. The immediate question should be, then what did it test positive for? That's the immediate question that should be asked by a medical professional. Guess if this one did.
Emma have cystic fibrosis?
No, she does not.
Okay. Now, did you also do the 1 month wellness check of Emma on?
No. Oh, it didn't test in the confirmatory. Then fuck it. Yeah, I'm fiery red. Yeah, cystic fibrosis shows up on a fuck ton of the first test, and then they rule out the absolute vast majority of the cases. Yeah. Let's just say if you at the end of her testimony feel, yeah, I want to send my kids to her, then you should not have kids. This pediatrician, well, let's just move forward. You will notice, because as we move forward with this, my frustration will just go larger.
April 17, 2023.
I did.
And what did you do on that wellness check?
So a 1 month wellness visit is to assess growth, if she's gaining weight, if she's getting taller. We also check for head circumference as an indirect way to see if her brain is growing. We also assess development, if she was meeting milestones for a 1 month old. And then there is a lot of anticipatory guidance as to what to expect in the next few months and what should be done in the next 3 months.
And was Emma meeting all her milestones?
Yes,
Was she also growing properly?
yes,
Did you also do the 2 month wellness check on May 18, 2023?
I did.
And what did you do on a 2 months checkup?
I want you to put this into the back of your memory here. Monthly wellness checks for newborns. I want you to remember what she says about this specific.
Pretty much the same. You're assessing for growth, weight, height, head circumference. We are assessing for development. The parents are usually given a questionnaire, which is a developmental screen, and then we go over the results during my exam, and then we examine the child. And also immunizations are given at the 2 month visit.
And was Emma meeting all her milestones?
Yes.
Now, were there any concerns that the mom expressed to you at this appointment?
Nothing out of the ordinary. No.
Okay, nothing out of the ordinary, but was there something that she brought up?
That she was not feeding as well on some days is what she said. So we went over her growth charts. Her weight gain was very appropriate. And we talked about how infants, when they feed, they don't feed the same way every day. Maybe they are in a growth spurt and they eat more. And when there is no growth spurt, they're not eating as much. But overall, she was gaining weight very appropriately. Her growth charts looked very good. So I reassured mom.
I guess associated with the topic of feeding, is it at all unusual for children, for babies to not be able to poop for several days?
Yes,
So, Karen, did you say that was unusual or normal?
it's normal.
Now, do you remember the appointment with Emma on June 6, 2023?
Yes.
And who was at that appointment?
Emma, both parents, and Emma's sister Arya.
And how old was Aria?
She was about 3 years old at that time.
And what was the reason for the appointment?
The reason for the appointment, which my receptionist noted, was the soft spot on top of her head feels weird.
Okay, and is that a common reason for an appointment?
It can be, especially for first-time parents, but Emma is a second child. So when I saw the reason, I was a little confused. I thought, this mom knows babies. This is her second child.
Now, if you were here on episode 1, in opening statement, the prosecutor said, basically, the mother didn't know that the baby had a soft spot. And we knew she was lying, because nowhere in any material does it say that what the mother reacted to was the soft spot in itself. It was, this soft spot feels strange.
What is this about? But once I entered the exam room and I asked them my first question, that cleared up my doubt, because it wasn't the soft spot on the top of the head she was talking about. She said there was a soft swelling on the side of the head.
Yeah. So the lie from the prosecutor in opening statement, even worse, they weren't even talking about the soft spot. They were talking about, my child has a weird soft swelling.
That seemed to move around.
Okay, and did you see that swelling?
No, there was no swelling when I examined the baby.
Now, was there anything else that either parents told you about Emma's condition?
Yes, there were several things. Mom kept saying that there was a swelling on the side of the head that seemed to be there, and then it seemed to move around a little bit, but now it's gone. And I could not think of any diagnosis that would fit what Mom was describing. There's nothing that should come up on one side of the head. I kept asking more and more questions, and she said sometimes one side of her face seemed swollen, and then 2 days later, the other side of the face seemed swollen, and they thought maybe it's the baby laying on one side that's causing the swelling, and then it's disappearing and it's coming back. And at this time, I'm trying to run a list in my head, what can cause this, what can cause this, and nothing seemed to fit that diagnosis. So I proceeded to do a much more thorough exam of the baby while asking more questions. Mom also said that her right foot, she seemed to hold it at a different angle, and she's not moving her right leg as.
For me, this sounds like, okay, we have a concerned parent who, okay, something is going on. I don't know what it is. Hello, pediatrician. Please help. That is what I'm hearing. And by the way, let's see here. common types of infant swelling. Cephal hematoma, subgeal hematoma, Kaputsu, whatever. There are three immediate. Just by Googling. But this doctor says she couldn't think of one. This pediatrician specialized in child illnesses couldn't think of anyone. None whatsoever. While Google says, well, they're three different.
As much as the left leg for the past 2 days.
And did you notice anything wrong with the child's foot at the time?
The examination of the foot on both sides was normal, but the right thigh was much more fatter than the left thigh. So I proceeded to take some measurements, and the right thigh was 2 centimeters more in diameter compared to the left thigh.
So she initially didn't notice anything. But when she measured it, 2 centimeters is about 2/5 of an inch in diameter. In a baby, in an infant, that's a lot. That should be visible by the naked eye that the leg is swollen. And she didn't notice. Well, okay, so it's 3/4 of an inch. 3/4 of an inch in diameter. In a 2-month-old, 3-month-old. That's a fucking lot. And she didn't notice until the mother pointed it out to her. Would you feel safe bringing your kids to this pediatrician?
Mom had also said that she was not moving her right leg as much. She was moving both legs spontaneously. She did move her right leg a little less than the left leg, but this is a child who does not move on command, so we can only observe and see what she's spontaneously doing, and it kind of seemed okay.
Now, did the dad make any comments about the foot or the leg?
The dad was reassuring Mom that this is a normal baby foot, chubby, chunky, she's gaining weight, and it looks different from what it did when she was born, but that's all normal. He seemed to be reassuring Mom that, look, honey, everything's okay.
And then, so after he made these observations of the baby's foot and Emma's thighs, what did you do? What happened next?
Well, because the history was not consistent with my exam, the things that the parents were telling me about the swellings over the head were not fitting with anything that I could think of. And
didn't fit anything that you could think of. While Googling, 3 different. And then we have discoloration and swelling of legs and feet in infants. And again, Google, half a dozen different things it can be. And none of it comes to her mind. None of it.
The limb length discrepancy. I was just going over the list head to toe, what did you see here, what happened next, and what happened next, and so on. Father told me that he saw some purple discoloration behind her right ear. But when I examined the baby, the skin looked completely normal. So I looked up and he said, oh, I have a picture on my phone. And he proceeded to take the phone out of his pocket and showed me a picture of a baby's face with the ear and some bruising behind the right ear.
Did you notice how she changed wordings? She changed it from discoloration to bruising. First of all, this is still, in my opinion, parents being worried because something ain't right here. While she, this pediatrician who's supposed to know all other things, knows jack shit nothing. And then you have the discoloration behind the ear, which she now says it's a bruise. Now, I already know, but I can tell you already. That went away completely in a couple of days, which rules out a bruise. Because a bruise changes color over a number of days, even in 3-month-olds. It starts out as a bruise and then it changes color, it becomes a bit yellowish, and all of that. No, it just disappeared. And this was just days before they went to her. There should be, if it was a bruise, it would still be there. Which rules out bruise.
Chunduri, I'm approaching Western Northwest States Exhibit 1. Do you recognize this?
Yes, this was the photograph that I showed.
Do you remember this time, state what type of Exhibit 1?
Any objection?
No objection.
Permission to publish?
Oh, okay. Mr. Lord, I'm going to be lowering the screen. I don't know where you are in relationship to the screen coming down, okay? Don't want to start with it.
Lowering the screen, okay. Yeah, that's a screen.
Mr. Darn, if you need to move around or.
I'm not following up for it.
Okay. Great. On the sheet, you may publish.
Thank you.
Put myself up over here so everybody sees properly.
All right, Dr. Chunduri, you said that this was the photograph that Mr. Hernandez showed you?
Mhm.
Okay, and what did he say this was?
He said he saw.
There is discoloration here. Now, this is a very bad of the screen does not reflect what it actually looks like. But it is discoloration behind the ear and a bit up on the ear.
Awesome discoloration. I asked him how old that picture was. He said about a week old. I
That's
immediately
a week.
asked him why he didn't seek medical care at that point. And he said the baby seemed completely happy and content. She was feeding as usual, sleeping as usual, and therefore he didn't think that it needed care. And it went away on its own, is what he said.
Yeah, it went away on
Did
its own.
Mr. and Mrs. Hernandez,
Not a
did
bruise.
the defendants ever reach out to your office about any of the other swellings prior to this point?
And Your Honor, I would ask her to clarify what other swelling she's referring to.
The swelling to the face, swelling to the head, did they ever reach out to your office about those phones prior to June 6, 2023?
So June 6th was a Monday, and that was the appointment that I saw them for. I believe they asked for an appointment on the preceding Friday. I was
Yeah. They called her. They called her and asked for an appointment on Friday, and she couldn't take them until Monday. Meaning they noticed this about a week earlier and tried to get an appointment. She couldn't take them on Friday, so she took them in on Monday. How does this sound anything other than concerned parents?
out of office, so they got the first available appointment on Monday. But it was only for the soft spot feels weird question, nothing about the face, nothing about the feet or the legs.
And when the defendant, Mr. Hernandez, showed you this photo, what did you do?
Well, my first question was I couldn't see the face, so I clarified and verified that this was indeed Emma's picture, and he said yes, this was Emma. And I told him that, even though Emma's exam looks completely normal today, except for the thigh swelling, this discoloration and bruising can indicate that something serious is going on, and this should be investigated immediately. The best way to do it would be to take her to the emergency room at Children's.
So, this I believe is an afterthought. Let's see. They show up at your practice. They had swelling, which they tried to get an appointment for, is now gone because you couldn't take them earlier. Now instead there's swelling of the thigh and something weird going on with the foot, which you just, I don't see anything, even though as you Google symptoms, you get a variety of answers, of which she does not have one. But the discoloration behind the ear, that she reacts to, which went away by itself. I don't think that's true.
I told them that I would make a call to the ER physician, but since Emma was breastfeeding, I asked if they would like to go home to pick up a snack, for mom, or a change of clothes, and then head over to the ER. They said they would do that, and I called the ER physician. I told him about my exam findings and the history of what looks like bruising on that picture. The ER physician agreed that she needs to be examined immediately. I called father back on the phone, and he said they were about to go to the hospital. Their bag was packed and they were heading to the hospital.
So they are following their pediatrician's advice. Okay. Concerned parents believing, we are about to get help.
And did you ask if anyone else had taken care of Emma?
Yes. This I asked multiple times if Emma was in anybody else's care, even if it was briefly, or if Arya was holding her sister unsupervised, even if it was for a minute or so. Both parents denied that anyone else was involved in Emma's care. It was always mother or father or both of them.
And in your experience as a pediatrician, why did you feel that after seeing this photograph as well as the physical examination of Emma, did you feel the need to send them to the ER?
Any sign of injury or bruising in a child who is non-mobile is highly, highly suspicious of non-accidental trauma, and that's the training every pediatrician gets, every medical student gets. And once I saw this, I was kind of worried there, and I felt that it needed to be investigated right away.
Non-accidental trauma. So, Miss Pediatrician, you didn't put all the symptoms together. You saw that one and thought non-accidental trauma, which in layman's term is abuse. Now, for me, non-accidental trauma could mean one of two things. Yeah, abuse, but also an underlying deficiency that is not an accident. If you put all these things together, that is called diagnostics, what a pediatrician is trained for. But she ignored everything else and went for, yeah, that looks like a bruise. Even though at the time you saw her, it was completely gone, not even a trace of it, which is not how bruises work.
And at just short of 3 months, was Emma able to walk?
No,
Was Emma able to crawl?
no,
Was Emma able to roll over?
no.
On June 9, 2023, did you do a follow-up phone call?
I did.
And who did you talk to?
I spoke to the father initially.
And in talking to him, what did Matthew Hernandez tell you?
The first thing he said was that he couldn't believe what was happening. He expressed frustration.
Yeah. At this point in time, they took baby Emma at the emergency room. They took her away from the parents. They barely got there. Yeah, we are going to hear about it.
At the whole process, that he was not allowed to be with his children. He said he would never intentionally hurt his children. That this has been very rough for their family, especially for the mother, because he told me that she couldn't sleep well at night. She kept thinking that she heard the baby cry and she would wake up. He also told me that he and his wife were recounting all the events that had happened prior to the visit at my clinic, and trying to see what could have caused this. And he asked me if Emma is breastfeeding and mom feeds her in a rocking chair. So he asked me if, while nursing the baby, if Emma let go of her latch for a second, and if her head hit the armrest of the chair, can it cause injuries like this, was one of his questions.
This is the father brainstorming, because he just lost his child. They took the baby Emma away from the parents. So he calls the pediatrician, who he thinks had nothing to do with it, wildly speculating what could have caused this. This bruising that disappeared, this discoloration. Not a bruise, discoloration. Of course he's brainstorming, because he still thinks she is there to help.
I told him that I couldn't say at this point, but since all the experts are involved, tell them what you told me, and also tell the social workers what you told me, and that they would, help him from there. He then asked me if him trying to get the gas out of Emma's stomach when she's fussy could have caused her injuries. And I asked him to explain that, and he said that, when Emma was fussy and they suspected that she had some gas in her stomach, they would try to move her legs and hips in order to expel the gas out. And he said, I'm a big man and Emma is little, and if I leaned too much onto the baby, could this have caused any of those injuries? And I told him the same thing, tell the doctors at the hospital and also tell the social workers the same thing. The other thing he said was that Emma was not taking a bottle too well and she refused to feed from the bottle at the hospital, and she kept crying and she's hungry, and only after she was discharged from the hospital, after mom breastfed her, she then fell asleep. That was the other thing he said.
And do you see Emma's parents in the courtroom here today?
So I can see them.
Let the record reflect the witness has identified the defendants.
Now, if you were a juror, ignore what I have said. Does this sound anything but concerned parents seeking help? Because abuse cases, in my experience, the parents do not seek medical help. It's rather the opposite. They keep their kids away from everything.
Nothing further.
Oh, and now cross-examination. Let's start with Christina.
Okay, good morning, Dr. Chunduri.
Good morning.
All right, how long had you been working with the Hernandez family as of June 2023?
I also took care of Arya from the time she was 6 months old.
Okay, and Arya was born in January 2020, is that right? Okay, so you had been working with this family since about June of 2020?
Correct.
So about 3 years, they had been bringing Arya in and then Emma after she was born, right?
Correct.
Okay. And so in this time, about how many visits total do you think you had with the family? You're still projecting.
Do you want a rough estimate or do you want me to?
You can do a rough estimate.
And she counts on her fingers. Now, do I do that sometimes? No, I actually don't. And if I saw a pediatrician and I asked, how many times have we been here? And she starts counting her fingers instead of looking in the chart, or I would be worried. I know a lot of people count on their fingers. I know that. But I don't expect a medical professional to do that.
About 7 or 8 wellness visits and maybe 4 or 5 sick visits.
And is that approximately a normal number of visits for a
Yes.
child of that age?
Mhm.
Okay. And so they were making the appointments and keeping the appointments. And were you always the pediatrician doing the exam, or were there ever any other pediatricians who worked with you in your practice?
I am by myself.
Okay. So it's all you. So in those 3 years that you had been working with the Hernandez family, with Arya and then Emma, had you ever had any kind of concerns that they were abusing their children?
No. But my first visit was when she was 6 months old, and she had a developmental delay. gross motor delay. She wasn't doing the things a 6-month-old should be doing. She wasn't rolling over. She wasn't sitting up with support. Parents didn't seem too concerned. I asked if the previous pediatrician brought it up. I do not remember what they said, but nobody was very concerned. And Arya is their first child, so I told them exercises and techniques and referred them to physical therapy because there was a definite delay.
What kind of physical techniques did you refer them to?
I referred them to a physical therapist
Okay.
so that they can help with gross motor development.
Okay. So first child healthy, no signs of abuse whatsoever. And then of course they call their pediatrician because something's off. And again, remember, she had just a few days after Emma was born, 1 month old, 2 months old, and then on the 3 months old. So remember that. And she saw nothing wrong until the parents brought something up.
And they kept those appointments, right? And continued following up?
Yes. I saw her again for her 9-month wellness visit, at which time the delay was far more obvious, but she hadn't started her physical therapy yet, but I believe they had an appointment very soon in the future. I did receive notes from the physical therapist thereafter. And over the next few months, she caught up on her milestones.
And so I guess you probably experienced parents kind of on a range of anxieties. Would you say that's fair?
Yeah.
And you have some folks who are more or less anxious as they display in your office?
Yes.
Now, and you told the folks from CHOA that you didn't ever have any concerns about non-accidental trauma from this family prior to this incident on June 6th, right?
Correct.
Okay. And so going back to the newborn visit, so your office performed the screening for the cystic fibrosis mutation at birth, right?
No, it's the birth hospital that does it. They collect blood from the infant and send it to the state lab.
Okay. So you got the results in time for the 2-week visit?
It typically takes 10 to 15 days for the results to come.
And now, so this is a sweat chloride test and IRT, is that what's performed?
The sweat chloride test is the confirmatory test that Children's Healthcare of Atlanta did. The screening test is from a blood specimen. It's literally a drop of blood that they take from the infant's heel, put it on a piece of paper, mail it to the state lab.
And that's where they do the genetic testing that confirms whether or not there's the mutations that are associated with cystic fibrosis, right?
Correct.
And so there are multiple mutations that are involved in cystic fibrosis, right?
I'm not an expert on this, but
Okay.
I think there are 3.
Okay, well, and because you mentioned false positives before, but it wasn't actually a false positive. She did have the mutation. She did have the genetic variant, right?
It was a false positive because she doesn't have cystic fibrosis.
Well, and right, and we understand she does not have the condition cystic fibrosis, but she does have a genetic mutation on the genes that are related to cystic fibrosis. That it wasn't like the state lab got it wrong.
Attorney's arguing.
It's cross-examination, Miss Prosecutor. You're allowed to lead the witness. But here it is the prosecution who knows where they're going with this. Because yes, baby Emma had a mutation that is needed, quote unquote, to develop cystic fibrosis. But she didn't have all the markers for cystic fibrosis. So when they call it a false positive, it's a truth, but a modified truth, because it's not a false positive as it shows nothing.
I left what you said. Thanks. You can answer that.
I do not know what techniques the state lab uses. I am not the genetic expert here, but I know that all screening tests are designed to catch everybody who may have the disease. And in doing so, they will catch a few people who don't but might. And the confirmatory tests, the gold standard tests are there to diagnose the condition. And that test was negative, so she does not have cystic fibrosis. Other evidence that she does not have cystic fibrosis to me was she was a thriving baby. She's growing well. She never fell sick. Infants with cystic fibrosis start exhibiting symptoms very soon.
That was not the question. Did she have that genetic mutation?
After birth, so she did not have it.
Right, well, and again, I'm just trying to figure out, when you say false positive, in your report from Sunshine Pediatrics on, I think it's page 18, if you have it to refer to, this is regarding the treatment for the abnormal findings on newborn screening.
Mm-hmm.
And that's the lab, the sweat chloride test, and it notes IRT elevated. What's IRT?
It's the mutation.
Yeah. Remember when she said when asked by the prosecutor, she said everything was normal. Well, if everything is normal, why does this test show something else than normal?
So IRT is elevated and mutation in CFTR gene, putting infant at higher risk for cystic fibrosis, right?
Yes.
Okay. And so, again, I just want to emphasize, I just want us to be clear. It's not like they got it wrong and she didn't have the mutation. She just didn't have enough of the mutations to be diagnosed with full-blown cystic fibrosis, correct?
Yes.
Okay.
Once again, the mutation is designed to be a screening test. The gold standard is still the sweat chloride test, and she was scheduled for that in the second week of April.
Right, and so I'm just trying to figure out, because we've got abnormal findings on the newborn screening. And so did that give you any cause for concern going forward with Emma Hernandez?
Not at all. As I noted in my note, she is asymptomatic, she is gaining weight, and she is thriving well. Things that would not happen if she were indeed to have cystic fibrosis. If she wasn't doing any of those things, we probably would not wait for her to have a scheduled test. That would be an instance where we would say, hey, she needs to be seen today and we need to do the test today.
Okay, so it didn't indicate to you that there needed to be any further genetic testing done?
No, we referred them to the experts. I would let the experts take care of that.
Okay, well, but it didn't cause you to refer them to any additional genetic experts, did it?
So there are multiple people who make sure that infants are well and continue to grow well. When we received the newborn screening results to our clinic, when they were mailed to us, and we tried to contact parents were already aware of it because the state lab and the geneticists had already called them and made arrangements. So.
Okay. And so did you ever treat Emma Hernandez again after June of 2023?
No.
Okay. So you wouldn't be familiar with any subsequent genetic screening results?
No.
Okay. All right. So going back to the newborn visit that you did with Emma Hernandez on March 16th, you've got, and this is on page 20 of your report, it looks like, you've got the assessments listed, and you've got the neonatal jaundice listed as one of your assessments, which you already mentioned, right?
Mm-hmm.
And then you've got other specified conditions originating in the perinatal period.
Mhm.
What is that referring to?
So the diagnosis, the assessment 3 and 4 are linked. The other specified condition is number 4, which is weight loss.
Okay, so you're saying that Emma had abnormal weight loss on her very first newborn screening?
This is the code that is given by the Medicaid, Medicare services that we all follow throughout the country. So the code for weight loss in the newborn period or
Just listen to the bullshit that she's spewing here. She put in abnormal weight loss in her chart. So you have a genetic mutation, abnormal weight loss, jaundice, and she does nothing. Nothing. Claims everything was normal. Bitch, jaundice, abnormal weight loss, and a genetic mutation is not fucking normal.
neonatal weight loss gets converted into these two codes. So I can put in my assessment in the system as newborn weight loss, but it gets converted to these two. And I was taught that this is like a check mark for me to make sure that yes, every baby loses weight, but we need to make sure she's not losing too much weight and that she's gaining her weight back.
Well, and I presume that's why you've got under assessments abnormal weight loss. So I guess there's normal weight loss for an infant just, after the birth process and everything. But then there would also be abnormal weight loss, right?
No,
And this is abnormal weight loss.
That's what I'm trying to say. There is no code for normal weight loss. The assessment we put in.
Yes, there is. It is. If it's not abnormal, you don't check that marker in there. If it's normal weight loss, you don't put anything in there. But you did. You put in abnormal weight loss. You knew about the jaundice. You knew about the genetic mutation. But somehow you chose to do nothing. And now on the stand, you have to explain yourself away. Perhaps if you had a shred of competence, you would have told the parents, hey, we have 3 things here that I'm a bit worried about. I would like to do more genetic testing. But no, she sat on her ass, leaning back, saying everything is normal, just as she tried to during the prosecution's questions. Everything's normal. I didn't see anything. I didn't feel anything. There was something wrong with baby Emma from the start. And you didn't care. That's a huge issue.
Is newborn weight loss, which I would say about 90-95% of the babies have. Very few bottle-fed babies don't have weight loss, but there is no code or there is no assessment as normal weight loss. This is what the coding system, which I don't decide, the CMS decides, Centers for Medicaid and Medicaid Services. So every baby gets this code. There is,
No, they don't. Because if the weight loss is normal, you don't check that box. You only check that box if it is abnormal.
She probably lost about 5 or 6 ounces from her birth weight when we saw her, which is considered within acceptable limits.
Within acceptable. Yeah, but you just said that she was a tiny baby. A bunch of ounces lost on a tiny baby is abnormal, which you put in your chart. And then you did jack shit about it.
baby is allowed to lose up to 10% of their body, of their birth weight. But I say that very cautiously because if that 10% happens in the first 2 or 3 days, well, that is abnormal. But if the 10% happens over a week's period, then it is normal. So I'm being very careful when I say that. But as far as Emma goes, the code, abnormal weight loss, refers to the weight loss that we noted from her birth weight and the weight that when we measured in the office. It's considered acceptable range weight loss.
No. Now, there are two options. One, she missed it. One, she didn't care. Or it is as she says, it was within acceptable range, but she still crossed in that box. And why? Medicare fraud. Because if you check that box, you can also check in something you did, and you will and you get more money from the Medicare system. So there are two options. She didn't care, or she's a fraud.
Okay, and you know, I've heard the same thing from other doctors, that these billing codes are just very difficult to deal with and obnoxious in all sorts of ways. But, you know, obviously there are many people who have relied on the report that you generated, both, you know, through at the medical center in CHOA and through DFACS and through the entire process, right? And so, but you're saying that even though the assessment says other specified conditions originating in the perinatal period, are there any other specified conditions originating in the
These
perinatal
two are
period?
linked. These two are linked assessments. So the other specified condition is the abnormal weight loss. They're linked assessments.
Okay, so the other specified condition is the abnormal weight loss, but actually it's not abnormal weight loss?
It's within acceptable limits.
Okay.
So it is abnormal, but within acceptable limits. No, you can't have it both ways.
Well, you have to forgive the lay people reading this who, when they see abnormal weight loss, are not expecting it to actually mean normal weight loss.
Okay, let me explain. So when we look at children, children are always supposed to be growing. We are the grown-ups. Our growth is done. I mean, if we grow, this is not a good thing. But children are growing by definition. And this is one time in their life that you will see not growth, but actually weight loss. So we don't want to see it. And there are a few babies who don't go through that, but a majority of the babies go through the weight loss, and therefore we monitor that very carefully. And
Really? How did you monitor it? Because you didn't do jack shit until the 1 month checkup. You had this newborn assessment, and then you did nothing. Jaundice, abnormal weight loss, and a genetic mutation. And you didn't care.
there are acceptable weight loss ranges, and there are things that are not acceptable. There are things where I have put babies back in the hospital because they're losing weight too rapidly at 3 days or 4 days of age. So
Okay. But so the point that we can take away is that when we see abnormal weight loss, we should understand it to mean normal weight loss.
I would not use the term normal. I will say that she had abnormal weight loss, but it was still within acceptable limits, and the treatment was just to encourage mom to nurse on demand. I
Did you hear this shit?
wouldn't call it normal.
Okay, so you wouldn't call it normal.
It's within acceptable limits is the terminology.
Okay, so Then the next time you saw Emma was, on the March 16th visit. Was there anything else that, you mentioned in your examination that there was no cyanosis, so you did not see any discoloration at that visit?
No, I did not.
Had you seen the reports from the doctors at Wellstar that had diagnosed it at birth?
Yes,
Okay, so you saw that they had seen it at birth, but then you noted that you had not seen it 3 days later, right?
yes. What they had seen was acrocyanosis, which means a bluish discoloration of the tips of fingers, tips of your toes, tip of your nose. And that's very, very common in newborn babies. And that was resolved by the time I saw her.
And then, and so did you ever perform or have any skeletal surveys performed on Emma Hernandez, like x-rays?
No, I didn't have a reason to.
And then, so for the next visit, and then I did notice, when do you sign off on your records electronically?
Sometimes on the same day, sometimes when we actually submit the claim to the insurance. It's called TFL, timely filing limit. So,
Okay, so what's the timely filing limit?
for their insurance, 12 months.
So you just have to
year.
sign off on the record sometimes within 12 months? And is there any, it's beyond the insurance, is there any other significance to what it means when you electronically sign off on a record?
It generally means that I'm done with the record, like it's closed. But since I'm solo, there's no one else who's going to come into the chart. I'm the only pediatrician.
Okay. And did you send over any records from your practice when you spoke with the ER over at then Scottish Rite?
No.
Okay, so you didn't send over any of the records?
I made a phone call.
And in that phone call, did you speak with the doctor directly?
Yes.
And did they indicate that they would be pulling records from any other source?
No.
And you noted, I think, on your visit, in May, that she was moving all of her extremities well, right? I think you noted that on all of the visits that she was moving her extremities well, including the one in June.
Yes. But I also noted that she wasn't moving her right leg as vigorously as her left leg. But it's very difficult to say if it is normal or abnormal because I'm not telling the child, hey, lift your leg, and she's able to lift her leg, then I can tell. But
Well, you did see it after the parents pointed it out. It seems like you didn't care. Just a visit, check the things that seems to fit, and then off they fuck.
because of her age, I could only say that, well, she's moving it and she's moving it spontaneously by herself without me making her do anything. But very clearly the range of movement on one leg was different from the range of movement on the other leg.
So you have jaundice, abnormal weight loss, a genetic mutation, all that in the history, and then a leg moves visibly less. But the thing that catches your attention is a discoloration behind the ear.
And if we're talking about, a tiny little 3-month-old who's, you've got her on the exam table, you've got her parents with her, about how long did you spend with the Hernandez family on June 6th?
Probably around 40 minutes. And like I noted in my exam, I was doing like a very thorough exam. I was turning her over, I was pushing, prodding, palpating everywhere, and she was happy as can be, very content. She was very comfortable.
Okay, so she's happy, content, comfortable, does not appear to be in any pain or distress. And then I think you mentioned that she's smiling at both of her parents. So she's not, indicating any pulling away or fearfulness or agitation.
She was at that age where developmentally, social development, they develop what is called a social smile, where they start to recognize caregivers who are with them all the time, and they give a smile of recognition. Before that, it's just random smiles, but around 2 months, 2.5 months, they develop a social smile. And at that particular visit, it was very obvious whenever, she locked gaze with either of the parent, she would suddenly give a smile of recognition. A very cute smile.
And then I think you mentioned that Aria was in the room too, kind of trying to get her parents' attention the whole time.
Aria was actually there for a visit of her own for a ear infection recheck. So we quickly did that, I think. And then, yeah. She was very comfortable. Aria was very comfortable with both parents. Yeah. If one of them was talking or standing up and trying to help me with the exam, she would just slide out of one's lap and go to the other's lap.
So it's really appearing like kind of
none of
a
the
happy
kids.
family.
None of the kids.
Yes.
None of the kids show fear to either parent. And you have this baby with a history of deficiencies. But then, because of a discoloration behind the ear, you decided to throw the entire family to the wolves. Anybody, everything I hear about what this witness is actually saying is concerned parents who just want to find out what is going on.
Just asking for her observations about her demeanor and characterization. She's made the same in response to the state's questions.
All right, I'll let the witness answer. You may answer me.
Yes, Aria seemed very comfortable with both parents.
And Emma, like we just talked about, right? With this. And then was anything different about that at any of the previous visits?
At the previous visits, Emma did not have a social smile yet.
Well, and then with Aria, did she also appear happy, content?
Yes.
Okay. All right, and so you're a mandated reporter, right, as a pediatrician. So you are legally required to, anytime you have even the suspicion of child abuse, you've got to report it, right? And if you just make sure to answer out loud so that.
Yes, I'm a mandated reporter.
And so about how many times have you had to make a report in your career?
4.
And do you ever follow through with any of those cases?
All of them.
So you've been following through with Emma Hernandez's case?
I have auxiliary staff privileges at Children's where I can log in, and if any of my patients are admitted there, I can look at their notes, their investigation results. And I followed for about 3 or 4 days, at which time when I tried to access her chart, there was a pop-up that said, unless you are directly involved in taking care of this child, do not access this chart. And I was not involved. The child was at the hospital, and that was the last that I had accessed her chart or heard anything from anybody. We just received faxes asking for medical records. I gave them, and then the subpoena.
So was there anything unusual about that pop-up message that you received?
No, it's protocol for sensitive cases.
So that is what you had experienced in previous cases as well, that after about 3 or 4 days, you as the initial pediatrician are blocked from the case?
Well, this was the first one that I'm not at the hospital. I'm in outpatient practice. The other ones were while I was working at the hospital, so I did have full access, but yes.
Okay. So the auxiliary staff privileges at CHOA, does that have anything to do with how your records go to them?
I don't understand.
Like in terms of how your records, and Your Honor, if I could approach with the. So we've got these records from CHOA, and I believe your material is a part of this. And so does your auxiliary staff privilege at CHOA have anything to do with how your records are put into the main record for Emma Hernandez?
I do not understand this question. The auxiliary staff privileges mean that if my patient is admitted there, I can access my patient's charts and results before they can fax them over to me.
But she was your patient.
Okay. And you said that previously you had full privileges, not just auxiliary privileges?
Not at Children's. I was talking about the other abuse cases that I had reported. I was a staff member at the hospital and therefore was directly involved in the patients.
In which hospital was that you had?
This was in Florida, Sacred Heart.
And so did you do any further consults with any doctors after you spoke on June 6th?
No, I knew I sent her where she needed to be, and I would let Children's take over.
Okay, but none of them, like, did Dr. Messner ever call you to speak about anything that you had seen or experienced?
Is she the ER physician?
No, he's one of the techs.
No.
Okay, so did anybody from Children's Hospital contact you as the pediatrician who had made this report?
Yes, on the day I sent her to the emergency room, I had made the first phone call informing them of my concerns. All along thinking the baby looks normal. I hope they, are looking for this. I received a phone call from another ER physician a few hours later asking me, why did you send this child? What made you suspicious? And I repeated the same thing that I had told the other ER physician, and she told me that this infant has multiple fractures of varying ages. So I'm glad you sent the baby here. And that was the last conversation I ever had from anybody with children.
Okay.
Remember this. Various stages of healing. Baby Emma had been with her on monthly checkups where this pediatrician saw nothing wrong. Now, how does that not be counted into this evaluation investigation? That she didn't notice anything. If these fractures, hairline fractures, are in different stages of healing, that would mean that they at one point in close time to one of her examinations was freshly fractured. How can you not notice that if it is abuse? Wouldn't there be, if there was a fracture due to abuse, wouldn't there be colossal bruises foot, thigh, ribs, if those were broken by force, wouldn't there be bruising? In her charts, newborn, month 1, month 2, month 3, nothing. So how can she have? How can it be abuse if there is no sign of abuse through in all the months? Well, here comes the non-accidental trauma in. Non-accidental means it's either abuse or it is an underlying deficiency. And they already knew she had a genetic mutation and abnormal weight loss and jaundice at birth. How does a system manage to ignore all that and take baby Emma away? Because all she sent baby Emma therefore was a discoloration behind the ear that had already disappeared. Bruises doesn't disappear overnight. They fade out under a number of days, weeks even. And she saw nothing. There were no bruises because baby Emma had an underlying deficiency. That should have been the answer from the get-go. But once she reported in and Showa took over and the child abuse specialist took over, tunnel vision. It has to be abuse because that's their job. Their job depends on finding abuse. Their job don't depend on finding other reasons. They all get paid, or in that system, they get paid to find abuse.
Okay, so the last conversation you had with anyone from CHOA was your second conversation that you ever had with anyone from CHOA, and it was on June 6th, 2023. All right, I don't have any further questions for you at this time, Dr. Chunduri. Thank you for your time. And
I don't know how this works, but I didn't hear something she said. Can we ask for her to repeat it, or do we just move on?
That was a Euro.
The last thing she said when she said that they reported that she had, was it varying ages of?
Right. So
Yeah, that is a good catch from one of the jurors. Various stages of healing, various ages of healing. That's a good catch by the jurors, by the juror. How can she have various stages of healing if nobody noticed it? She didn't notice it. The rest of the Hernandez family didn't notice it. The parents didn't notice it. All of that combined with her medical history says she has a medical deficiency. But that didn't matter to Showa, because the moment the word abuse was said, it could only be abuse.
Yeah, sorry, I don't know the rules.
Certainly. And so as we were talking about the second conversation that you had, this was the call that was initiated by one of the ER doctors at CHOA to you. And then that individual gave you information, and I believe fractures of, they told you that there were fractures at different stages of healing.
correct.
Thank you.
Did they give you any other information at that time?
No.
And then you never talked to any of them ever again?
No.
Until you got the subpoena for this trial?
Correct.
All right, nothing further. Thank you very much, Dr. Chunduri.
Good morning, Dr. Chunduri.
Good morning.
We've never had the pleasure of meeting before, okay?
I thought you walked into the room. I was
Just today.
Yeah.
Thank you for being here. I just have a few follow-up questions. I believe you testified that Emma was diagnosed with acrocyanosis, and you're aware of that diagnosis, right?
in the immediate newborn period, yes.
Yes. So you had a chance to review her newborn records, her birth records? Is that okay?
Yes.
So you understand that mom was also anemic during the childbirth as well?
Yes.
Would you characterize the parents as being cooperative during this entire process while they were at your office?
Yes.
You also understand that, did you run any labs at all on Emma at your office? Did you order any labs to be done?
No.
No labs, no x-rays, no genetic testing, no nothing. Despite, again, jaundice at birth. Genetic mutation, abnormal weight loss. No testing whatsoever.
Do you have knowledge that Emma's been diagnosed with vitamin D deficiency by child?
I do not know.
You agree that vitamin D is a hormone and not a vitamin, based on your education?
It's both.
Let's talk about the acrocyanosis a little bit. Would you agree that acrocyanosis is a condition which results in a bluish or purplish discoloration?
The term acro means tip. So it has to be the tips of your fingers, the tip of your nose, the tip of your ears, the tip of your toes. If you see cyanosis on other parts of the body, that's not acrocyanosis.
Well, I believe you just testified the tips of the ears, right? And the picture that you displayed here today was right near the ear, right?
It was in the ear, it was behind the ear, it was on the scalp behind the ear. The bluish discoloration was not on the ears.
But I believe when you first testified, you mentioned hands and other extremities, but you didn't mention the head or the ears.
I'm sorry, I didn't
An
understand.
acrocyanosis appear on the head near the ear.
Not near the ear, it's the tip of the ear. Near the ear is a misleading term. That is not acrocyanosis at all.
Would you agree that acrocyanosis is more common in females?
No.
Can you tell me what acrocyanosis is?
Acrocyanosis is when there is decreased blood supply to the skin. In newborns, it is because of immaturity, the thermoregulation, where if you're cold, you need to shiver and make heat. If you're hot, you need to sweat and cool off. That thermoregulation is very immature, very patchy, and sometimes it takes a few days for it to be established. So extremely common to see it in the immediate newborn period. Once they are warmed up, it goes away.
Okay. An acrocyanosis is typically associated with profuse sweating in the area of the discoloration, correct?
No,
No sweating at all in the area?
no.
Could we bring the picture up, Judge?
Yes.
Stacy, look at it. On the states exhibit on the screen, you can see the area around the ear. It's actually on the ear as well, the base of the ear. Would you agree that the markings are on also the base of the ear?
That's not the base, that's the back part of the ear, but the most blue discoloration that you're seeing is on the scalp, under the hair, and I can't even see the tip of the ear in this picture. It's covered by the finger. This is not acrocyanosis.
Council, let me interrupt. We do have a touch screen if you want to refer to specific.
Thank you.
Folks, I have a lot of nieces and nephews, been around them since they were born up to the oldest ones are now adults. Kids, even infants, play around. They sleep weird. They rest their head against weird places and fall asleep. That's not unusual, in my personal opinion. They scratch themselves. I mean, everything. I don't find this alarming at all. Yeah, as Mustang McCracken says, if you stop and think about it logically, to why would the dad abuse the kid? Take the picture, then ask the doctor about it. Yeah. And if the wife was abusing, why did she allow the picture to be taken and then go to the hospital with baby? Hey, please, doc, check this out. It doesn't make sense. But the medical history should have told them, okay, you have that genetic mutation, and all of a sudden you have weird swellings. Maybe we should order some tests. But no, her immediate reaction was, nah, let's send her off. Let's send the baby off to CHOA so they can take the baby away from them.
And doctor, the touch screen in front of you, if you touch it, it will indicate.
So,
I'm assuming it's working.
It's working. I think you need to just drag it.
so the blue discoloration I'm seeing is here,
Okay.
right? And acrocyanosis would be somewhere here. I can't even see that in this picture. That should just be the tip of the ear. If it's the entire ear or any other part of the body, that is not acrocyanosis.
Now you see the moisture also around the area of the base of the ear in this picture as well.
I'm not sure what I would call that. Maybe it's just normal skin.
You wouldn't say it's moisture, what would you call it?
I would say that it's reflective, it's shiny, and it could just be sebum, it could be oil. There's no way to tell what that is. It could be lotion that parents apply. There's no way to tell.
But you agree it's some type of moisture. Let's just generally say moisture.
And no, I couldn't tell.
Really? You couldn't tell? Is it because you made up your mind already? You don't know if this reaches the top of the ear because the finger is there. It's a discoloration. A weird discoloration, but it's just a discoloration.
Do bruises normally sweat?
No.
And bruises typically they'll persist for days, right?
Correct.
And typically, strike that. Are you aware of Emma's blood results that came back from CHOA?
No.
You mentioned that the sweat chloride test, though, came back negative from CHOA during your testimony?
The sweat chloride test was normal.
And that was you mentioned that Choa did that sweat chloride test, right? Well, if I may, I'm gonna enter the record, defense exhibit number 1, records. May I approve?
Yes, sir. Was she, did you see these documents?
Yes.
Which ones are these?
This is the one up to the.
That's fine.
Any objection?
No objection.
Will be accepted.
I'm gonna put it down. It's a little bit, that's all. I'll put it in. Yeah. Okay. If you could turn your attention to page 109 of the record, please. I may change the page number in a second. Actually, let's start with page 516.
Okay.
You see the metabolic panel that was completed there on page 516?
Mm-hmm.
And you see where it says chloride? And it says the chloride was 109, and it has an H next to it, which indicates that it was high. Is that correct?
Yes. You should also look at the normal range. The cutoff is 108. The difference between 108 and 109 is considered, I'm not sure what the correct term is, but depending on how you measure it, how you draw blood, that's still normal. I wouldn't want.
No. Here's how it works. You have the normal range, and then you have the abnormal range. The cutoff point is 108 on the high end. That means they have already counted in reasonable factors that could have made it up to 108. But after 108, it's abnormal. Remember, she said everything is fine. Fine, doodly, fucking dandy with this child. And now we find out again, another test came back abnormal. And she tries to explain it away by, no, depending on this, it's still within an acceptable range. No, the acceptable range is already in there. You cow. And the medical field says 108, after that, abnormal. It's not fucking hard. Follow the guidelines. You didn't. If you had followed the actual guidelines, maybe baby Emma would have gotten the help she needed at 1 month old. But you couldn't care less.
Worry about it.
So you would consider that a normal chloride test?
Yes.
Have you seen this test before?
No.
How did you get the information for the sweat chloride test from children?
I believe they were faxed to us. That was normal.
Did you bring that here with you today? Any of those records?
No.
Did you do a Z-score on Emma while she was in your care?
No. What is a Z-score?
Did you measure her head circumference? Did you measure
Yes.
her BMI?
Not her BMI. We measured head circumference. BMI measurements are usually done for children 2 years and older. and we do a head circumference for younger children.
Well, the complete Z-score would include BMI, weight, head circumference, and height, correct, typically?
The growth parameters that are recommended by the American Academy of Pediatrics for children less than 2 years of age are weight, height, and a head circumference.
You agree that Emma is also of Asian descent, correct?
I believe her mother is Asian.
Okay.
Yeah.
Would that affect the sweat chloride test as well?
No,
Yes, it does.
Well, isn't it harder to detect cystic fibrosis in Asian children versus Caucasian children?
not that I'm aware of.
Huh?
Would you,
Some pediatrician, she doesn't know this. I at this point in time, I would question what did you say that medical school in India? Can you name it? Was it India School of Medicine LLC.net.scam?
agree that the mean score value for Asians is typically lower than that for Caucasians on a sweat test?
I do not know that information.
Now Emma's arm turning blue or purple, would that be acrocyanosis, or would you consider that peripheral cyanosis?
The entire arm,
Yes, doctor.
that's not acrocyanosis.
Would you consider it peripheral cyanosis?
If I had more information about the central part of it, then I will call it peripheral.
Okay.
But you never tested. You never sent off for genetic testing, for blood testing, for anything. You never did anything for baby Emma. The parents had to point things out to you before you could give a damn.
So to be fair, you would agree you just didn't have enough information to make that determination?
Well, I did not see her arm blue.
Okay. Did anyone tell you that she had a problem with the arm?
No,
That's all I have.
Sure, thank you. Redirect.
Commissioner, just briefly, Dr. Chunduri, which leg was swollen when you saw her?
the right thigh.
The right thigh. And was that the same leg that wasn't moving as much?
Yes,
And I want to go back, where did I need to be? Just for clarification, States Exhibit 1, in your experience as a pediatrician, is this acrocyanosis?
no.
Okay, and in fact, what did Matt Hernandez call this?
I call it bruising.
He's not a doctor. You are. You are supposed to know the difference between the discoloration and a bruising. And the obvious way to check it, is it still there? No. Did it fade or did it just disappear? It just disappeared. Then it's not a fucking bruise.
Now, just going back, before you made any contact with the Children's Healthcare of Atlanta doctors, were you suspicious of non-accidental trauma?
Yes, any bruising in a non-mobile child is highly suspicious of non-accidental trauma.
Nothing further, thank you.
Hey, recross.
Just very briefly, Your Honor. So Dr. Chunduri, that picture was given to you by my client, Matt Hernandez, right? He didn't have any hesitation in giving it to you, did he?
No,
And he didn't have any hesitation in talking to you on the phone, did he?
no,
He didn't have any hesitation in immediately packing up his family and taking them to the ER as you instructed, right?
correct.
And there was not any legal obligation at that time for him to take the child to the ER, was there? That was his choice. But there was no hesitation, right?
Yes,
So that's correct.
Yes, there was no hesitation.
Okay. And he didn't seem worried about kind of going through everything that was going on with the family and anything that he might have done that could have potentially accidentally injured his child, right?
I wouldn't know.
Well, but I mean, you had the conversation with him, right?
Yes, I told him that once I saw the bruising, I said, this is serious, this needs to be investigated immediately. And he agreed, and he packed his bag and took the child to the ER as instructed, yes.
And then you talked to him a couple of days later, right?
Correct.
And again, he was very forthcoming with you, telling you everything about what was going on with the family, right?
Yes, whatever he has told me, I have documented that, and I have told you all today,
And yes,
pretty much from my notes, yes.
right. And what I just wanted to emphasize is that he was not trying to avoid you or avoid telling you things about his daughter or avoid showing you pictures of what was going on with his daughter, was he?
Yes, he wasn't trying to avoid it. I would not have been aware of the bruise had he not shown me the picture.
Ta fucking da.
I don't have any further questions. Thank you very much, Dr. Chunduri.
Dr. Chunduri, you don't have any of your notes here today with you, correct, or any of your records? Do you have some?
I have my notes.
Okay. Now, you mentioned that the Hernandezes came in, they were concerned about the head. They were also concerned about the leg, right?
The foot and the leg.
Thank you.
All right, anything else?
Hi, Robert.
All right, any reason why this witness can't be excused? All right. Ma'am, thank you for being here. You want
Thank you.
That was the start of the hell the Hernandez family went through. Folks, if you want to help other families, because now the Hernandez family got their children back. There are many, many families in the same situation. What you can do is support youarethepower.net. I posted the link in the chat, and I will post it in the description below. If you can, help them. That way, more families like the Tim's family, the Hernandez family, families who are in the same situation, innocent of abuse, with their children taken away from them, can get help to fight the government. That is what I ask of you. And I will ask that of you in each episode I do of this. Next episode will be next weekend. But now I'm going to send you all over to Megan Fox, who also covered this, but she is further along in the trial. So you get the spoilers. You get the spoilers. But thank you, folks, for showing up. Thank you over at Rumble. Thank you here at YouTube. Thank you so much. From me and Mr. Jingles, we'll see you on Meg's channel right about now. Okay. See you over there. See ya. Bye-bye.